Welcome back. New Yorkers are faced with the threat of what many health professionals are calling a tripledemic as we continue to brace the winter season. With viruses like the cold and flu affecting the health of New Yorkers, Chief Medical Officer of MJHS Centers for Rehabilitation and Nursing Care, Dr. Mohammed Butt, joins me now to discuss what you can do to stay healthy this winter. Doctor, thank you so much for joining me.
It's my pleasure to have you here. I greatly appreciate your invitation, and I am honored to be with you on this program today.
Thank you so much. So, I want to jump right into it. We've been hearing a lot about the term tripledemic. For those who are unaware, what is the tripledemic and what illnesses are included in it?
So, the terminology tripledemic is currently being used for three respiratory viral infections. The first one being the COVID-19, we all know. And the second infection is the influenza, commonly known as flu. And the third infection is caused by RSV.
Now, many of us are familiar with COVID, of course, and the flu, but what is RSV?
RSV stands for respiratory syncytial virus. Respiratory syncytial virus is one of the respiratory viruses which causes respiratory infection. It can present as stuffy or runny nose, fever, chills, cough, phlegm, headache, generalized weakness, body aches, and many more.
Now, I'm curious to know, does a common cold fall into this category, of winter illnesses or respiratory viruses?
Absolutely. The common cold is a common terminology used for all these respiratory tract infections caused by virus.
Now, I definitely want to touch on this because I think a lot of people will use the weather as, a reason why they may have gotten sick. So maybe they'll say, oh, I went outside without a hat. Can you clarify how much does cold weather actually, affect or play a part in how you contract any of these viruses?
So, in the common cold weather, we stay at home and we have most of the activities indoor. So when we are having those indoor activities, we tend to meet our friends and families as indoor. And if one person is sick, the infection is transmitted by contact or droplet to the others, our loved ones.
Okay, so to clarify, it's not because, it was 20 degrees outside while you're cold. Well, you have a cold. Okay, got it. Thank you so much for clarifying that.
Absolutely right.
Now, as a health professional, do you have any concerns as we approach this time?
Yes, a lot of people are tired of having face masks on, and we are not properly washing our hands. So the practice of face covering, hand washing, keeping the social distance is very important in a current time that we are going through.
Now, I'm so glad that you kind of mentioned that because I do feel like the pandemic has changed, or maybe it temporarily changed how we, approach viruses and, just dealt with being sick. What should people continue to do to ensure that they're not contagious?
So if you're sick, stay home, quarantine yourself, get yourself tested. It is very important to get yourself tested. Currently, we have home testing kits for COVID. And for RSV and for influenza, we should contact our healthcare agents, get ourselves tested at the urgent care centers, at our medical offices, and consult your practitioner to stay healthy.
Now, what are the different symptoms for RSV, COVID, and the flu? I know it's a lot for people to kind of keep up with and to kind of differentiate them, but can you talk about that and how can people know the difference?
So the symptoms, all the symptoms for all these three and the other respiratory viruses are awful. They are similar. it is difficult to differentiate based on the symptoms what disease are we coming across. But again, cough, phlegm, fever, chills, runny or stuffy nose, body aches, headache, vomiting, diarrhea, are all these symptoms of these current infections that we are currently having.
Now, I know you kind of mentioned that, people should stay home. I know during the pandemic, people would stay home for about 14 days. Is that still necessary? Do we still have to stay home for that long period of time? I know a lot of people probably don't want to miss work or school while they're sick, but is it something you still recommend? And what length of time should they stay home to recover?
So the recommendations have changed from the beginning of the COVID to now. The practitioners are following the recommendations by the New York State Department of Health and the recommendations from the CDC. So we should absolutely follow those quarantine regulations. There are criteria to return to your work. And the practitioners are very well aware they should absolutely follow those recommendations.
And can you quickly just brief us on what those recommendations are?
So you have to be fever free for at least 24 hours prior to discontinuing your quarantine. Your symptoms should be improving. And the quarantine period, the length ranges from 5 days to 10 days currently. So these criteria have to be met before you return to your work.
Now, what are some precautions older individuals or people with compromised immune systems can take to protect themselves during this time?
Beside the core principles of infectious control prevention that we mentioned earlier, the face covering, the hand washing, and the social distancing, they should get their COVID vaccine and their boosters thereafter, as well as the flu shot. If they are immunocompromised, or if they are 65 years and older, they should get their pneumonia vaccine as well.
Now, I know this same exact time last year, the topic of vaccines was still quite controversial. At this point, many New Yorkers are vaccinated, but do they have to get vaccinated again to ensure that they're healthy?
Absolutely. They should get their booster doses. It is a good time to get their booster doses now to keep themselves and their loved ones healthy.
And I know there's also a flu vaccine. Should people get both? Or, which vaccines should they get to stay healthy?
So the flu shot, we have been having a practice of getting our flu shot every year. So we should be getting our annual flu shot. And it is recommended to receive both the shot together. So you can absolutely get your both shots together if you're concerned about multiple visits to your provider.
Now, I really want to talk about children. We talked about older adults and people with, compromised immune systems. But how do we protect children during this time? I know, especially for the little ones, it is a little bit harder for them to understand, certain precautions. So what would you recommend a parent do?
So they should practice the face masking. They should have hand hygiene practice properly done, the hand washing and the use of the sanitizers, social distancing, and keeping ourselves away if we are sick, testing ourselves promptly, and again, staying away if we are sick. Keep the babies, the grandparents, and the immunocompromised away from you.
Now, many people have abandoned the use of masks this year because it isn't required for many locations throughout the city. Could you talk about how difficult that may make things a little bit for, people who work in the healthcare system? And what are your thoughts on that?
So I would definitely recommend face masking, especially when you are having an indoor activities. You may be in a period of um, in a period of getting in an infection. You may not present some symptoms, but you may have acquired the illness, and you ultimately may transmit that to your loved ones. So keep the mask on. Um, Continue the hand washing. Proper hand washing is very important. Just a hand washing is not. Proper hand washing
Right.
is absolutely recommended. And keep some social distances. We have learned through this pandemic that these three important measures can keep us healthy and away from those respiratory viral infections.
Now, I know the idea of a triple demic can sound, pretty intimidating and very scary to those who, are probably still dealing with the effects of COVID. One, should we worry about another surge? And two, how long do you think this will last?
So we have seen after the Halloween and after the Thanksgiving, there was surge in cases, and here we are after the wonderful winter holidays and the New Year celebration, and we expect to have some higher number of cases after these holiday season.
All right, doctor, I want to thank you so much for taking the time to explain this to us.
Thank you so much. Thank you for having me with you today.
Of course. To learn more about the MJHS, please go to their website at www.mjhs.org or follow them across all platforms at MJHS01. We'll be right back with more Open right after this.